And joining us now for more is Manuel. He's a senior research associate of the Overseas Development Institute in London, and he was the lead author and researcher for that report on global poverty. Mr. Manuel, thanks for being on our program. So there is some good news. In the last 25 years, the rate of extreme poverty has fallen by half, and yet there's still 800 million people living in extreme poverty today. So what are we doing wrong?
Well, I think some of the things we're doing right, and clearly economic growth is coming and it's driving down poverty in many places. But I think what we're doing is two things are wrong. First, we're not focusing the assistance that we give these countries to the countries that need it the most. And secondly, all countries need to live up to their UN target of how much aid to provide.
All right, so let's talk about the countries that are most in need. We mentioned Nigeria in our report. What are some other countries, and what's holding them back from tackling the poverty they face?
So we're thinking really countries like Malawi or countries like Ethiopia, as well as countries like Nigeria. We know really how to tackle poverty. We know it's a matter of making sure that everyone can afford to get to healthcare. It's a matter of making sure every child gets to school. And it's a matter also of making sure that the people that are most vulnerable, the elderly, children, those maybe living with disabilities, they have the additional targeted support that they need. We're doing that in many countries, but Nigeria is a very good example of where that's just not happening at anything like the scale that needs to happen to eradicate extreme poverty.
And so what is it that's holding them back? Why are these programs not working?
Well, the programs are working, but the scale of them is just not there. So Ethiopia has a much larger program than, say, Nigeria. Nigeria has very little of this kind of targeted support to the most vulnerable. It also has real problems for people accessing healthcare and people accessing education. So we know what the programs are. It's a matter of making them affordable to the poorest, and it's a matter of providing the network at the national scale that's needed. Coverage in Nigeria is particularly poor.
All right, Manuel from the Overseas Development Institute in London, thank you so much for speaking with us.
Thank you.